Welcome to the First Fill. My name is Katie Meyer, and I serve as the Senior Director of Content Creation here at APhA. This month, we're reviewing recent updates related to medication safety and are happy to provide you with valuable medication safety CPE for listening. Be sure to head to the Learning Library to ensure you don't miss out on your CPE credit. In this episode, I'll be discussing a recent cross-sectional study published in JAMA that evaluates prescribing patterns related to drugs and combinations of drugs that are high risk for causing QT prolongation leading to fatal torsade de pointes, which I'll refer to as TDP from here on out. Before we dive into the study, however, let's quickly refresh on mechanisms related to drug-induced prolongation of the QT. On the electrocardiogram, the QT interval is a measure of ventricular repolarization. Many factors influence the pathophysiology behind repolarization, including gender, age, heart rate, electrolyte concentrations, comorbid diseases, and our focus today, drugs. The most common mechanism behind drug-induced QT prolongation is a drug's ability to block IKR, which is a key potassium current in the heart that promotes repolarization. In most cases, drug-induced QT prolongation is reversible, but unfortunately, in some rare instances, exaggerated QT prolongation can provoke the polymorphic ventricular tachycardia, TDP, leading to syncope or, more severely, sudden cardiac death. In the United States, approximately 500,000 people are currently on hemodialysis. On average, these patients are cared for simultaneously by clinicians from 5 different specialties and prescribed 10 to 12 medications daily. Evidence has shown that people receiving hemodialysis who take medications that are known to prolong the QT with risk for TDP have a higher risk of sudden cardiac death compared to people not receiving hemodialysis. So with that background, let's dive into the study. The study was a cross-sectional study which included patients 60 years or older enrolled in Medicare and receiving in-center hemodialysis in 2019. The study specifically looked at new prescriptions for the 7 most frequently filled QT prolonging medications with known TDP risk and evaluated the timing related to acute care encounters, type of prescribing clinician and pharmacy that dispensed the medication, and concomitant use of medications with known drug-drug interactions with those 7 medications. You're probably thinking, well, Katie, just what were those 7 most frequently filled medications? I'm not going to tell you just yet to keep you in suspense and listening a bit longer. Overall, researchers evaluated records from 20,761 individuals who received hemodialysis in 2019. 10,992, or 52% of which filled one of the 7 drugs. 80% of these prescriptions were filled outside of an acute care event and were prescribed by non-nephrologists. 16 to 26% of the prescriptions occurred with use of another QT prolonging medication, mostly prescribed by different clinicians. And the most important statistic to me that I'll provide you today is that the majority of new use prescriptions, from 72 to 90% for QT prolonging medications with known TDP risk, particularly in combination with an interacting drug, was dispensed by a commercial retail pharmacy. So bottom line, we as pharmacists can make an impact and intervene to help keep our patients who are receiving hemodialysis safe from medication-related harm. I won't keep you in suspense any longer. The 7 most frequently filled medications with TDP risk in the study population were azithromycin, ondansetron, levofloxacin, ciprofloxacin, amiodarone, escitalopram, and fluconazole. Drug-drug interaction-wise, we need to be on the lookout for both pharmacodynamic interactions, so use of combinations of drugs that block IKR, and pharmacokinetic interactions, so use of drugs that reduce hepatic metabolism and increase concentrations of our drugs of high risk, like a CYP2C19 inhibitor in a patient taking escitalopram. These situations where a simple call to the doctor to suggest a dose reduction or an alternative, depending on the clinical scenario, could help save a life. One nice resource I'd like to recommend that I've used regularly in my practice is Credible Meds. With free registration, you can get access to a printable list that includes all medications associated with risk of causing TDP. You can also dive into medications and evidence at the individual drug level, and the platform lets you know if the risk associated is known, possible, or conditional. It's a great resource if you'd like to look up information quickly during your busy workday to help inform your decision making. Well, that's all I have for today. Remember, this month, by logging into APHA's Learning Library and completing a quick assessment and survey, you'll earn a half hour of medication safety CE. I hope this helps you as you're working through your licensure requirements. Take care.